Next presenter is Ali Williams. So if you want to join us, Ali. Ali's doing a medical imaging degree in the School of Curtin Medical School. Her supervisors are Professor Zhonghua and Dr. Mauro Vaccarezza. I think Mauro's here. We're very thankful that this particular scholarship is supported by the Perth Radiological Clinic Foundation. So.
Welcome online. My name is Ali and I'm a fourth year medical imaging student. The purpose of this project was to build a tool for anatomy and pathology education. And I wanted this tool to be fair. So it had to be flexible, accessible, interactive, and relevant. And I needed it to demonstrate a representation of real human anatomy. Traditionally, the study of anatomical structures in 3 dimensions is through the study of cadavers. However, cadaveric education is not accessible to everybody, and added to that, the COVID-19 pandemic saw a real push to online learning and using digital resources as a flexible alternative to these more traditional face-to-face methods. So we really need interactive digital resources, and we need them backed by quality research. In this context, virtual reality has shown fantastic, promising results. Specifically, virtual reality allows students to gain an understanding of the spatial relationships between 3D anatomical structures, which is difficult to obtain from 2D learning materials. So I'm going to take you all on a little student journey, because it's not fair that it's just me and these guys. I want you all to imagine you're a medical student. You all got into character really quickly. I'm very impressed. One of the ways that you might be tested on your gross anatomy knowledge is through medical imaging. This is a CT. You've got 3 months, and at the end of these 3 months, you need to tell me what each of these grey blobs represents. Which organs, which anatomical structures, and what's wrong? Is there any pathology? What other structures does the pathology affect? And you can't just apply your gross anatomy to this. You're going to need to know your gross anatomy applied to diagrams, plastinated specimens, but don't panic, although I see none of you are. We'll go and have a look at some online resources. Now, these are the online resources recommended by the American Association of Anatomy. They're very good. They've got some great images of cadavers, but they're not particularly interactive. These have also been developed, but they are very expensive applications with ongoing subscription fees, and they've been criticized for presenting very stylized models of human anatomy. The problem is that students are struggling to learn 3D structures from 2D resources. And I know this because I studied medical anatomy at the height of the COVID pandemic. And I used the online resources. I bought the expensive apps. Don't worry, I got the textbooks as well. I even hired a tutor. And it was really hard. So it was really important to me that this tool is as engaging and as interactive as possible. So with that, we had 3 objectives. The first one, to build a comprehensive model of the chest, abdomen, and pelvis, which represents real human anatomy using medical images and the software program 3D Slicer. The second objective was to investigate student attitudes towards using the model as a tool to support their studies of anatomy and pathology, and using the model in the 3D Slicer interface and through virtual reality. And our third objective identify any barriers towards using the model, and to determine the cost effectiveness. With that, I'm just going to grab my drink bottle. I'm really sorry, because I have talked a lot in practice for this, and my voice is going. So, just checking, have you got it? We're with this. Now, the first tool is the 3D Slicer interface. 3D Slicer is a software program for the visualization and analysis of medical images. I use this software to separate or segment the CT dataset to isolate individual organs and build this 3D model that represents real human anatomy. I used a mix of AI-supported automatic algorithms and a lot of manual segmentation for detailing and editing. Each of these organs is color-coded, it is labeled, and they can be switched on or off to view them in the different planes. For example, some of your very good students might have noticed that this case involves an aortic dissection. You could select it so that only the aortic dissection is viewable in the 3D plane. We have a pointer. In the 3D plane, in the sagittal view, coronal view, and in the axial slice as well. I'm not good with this pointer, I'm sorry. So remember all of those gray blobs? This is how they present now. And you can switch these on and off and be able to view just one organ, a group of organs, however you like. Now, not only have we created a 3D model of real human anatomy, but we've developed this tool that is able to create the connection between the 2D images and the 3D model. Even myself, as a medical imaging student, just these multi-planar slices with the overlaid model has been so useful for studying sectional anatomy. It is a professional requirement for radiographers to be able to identify human anatomy and pathology from medical imaging, and is also important for any clinician who needs to communicate urgent pathological findings or discuss their patient's medical imaging. Now, the great thing about 3D Slicer is that you can also view the model in virtual reality. And this is how you will see the model in the demonstration today. Using the virtual reality headset, you can view the model from all different angles, including inside the body, and you can take it apart to appreciate individual organs. You might recognize the thyroid, the lungs, the liver, the pelvis, and the large intestine. If you look carefully at the end of the large intestine, you can see the appendix. It was one of my favorite parts to segment because it was quite difficult and took a lot of researching to make sure that I was actually with the appendix and not something else. And the model was quite cost effective. I used open source software. That means it's free. You can buy a VR headset for under $500 the way that technology is going. And although I needed a very powerful computer to build the model, you can visualize it on any standard laptop. Next, I performed a qualitative study involving 11 students from the Curtin Medical School, predominantly medical imaging students, but across all year groups. I gave them a brief tutorial on how to use the model in 3D Slicer and in virtual reality, and allowed them to freely explore the model. Next, they filled out a survey asking them how, if at all, the model would benefit their studies of anatomy and pathology, and also asking them when it would be most applicable in their first year, second year, towards their final, fourth, fifth years. And I expected them to spend about 30 minutes per session, but some of the students spent 40 minutes in the virtual reality environment alone, so it suggests it's engaging. This is some of their work. These are the results. I really loved how all of the students had their own way of interacting with the model to suit their own understanding and their own way of learning. For example, this student over here has hollowed out the thoracic cavity, so you can see right up through the chest. This patient has made the model really, really large and shrunk themselves down very small so that inside the body, it's very magic school bus. This student has been taking apart the model and putting it back together themselves to see how those structures are relating to each other and compare them. And they all had some really valuable insight as well. 3D Slicer, they talked about it being interactive. They talked about having a tool that they could use in their own time for their own study. A lot of that switching on and off the organs to test their knowledge of sectional anatomy. This medical student said it was extremely helpful for 4th and 5th year medicine with exposure to clinical medicine and imaging findings, so it's relevant. Virtual reality, they talked again about it being interactive, enjoyable, fun. Being hands-on with a virtual model helps me to understand information better. And I was also grateful for critical feedback. Some of the models said it was a bit difficult to learn to use the controllers in the virtual reality environment, but one of the major virtual reality applications for anatomy education recommends a 1-hour tutorial before you use their software. And all of the students picked it up in a matter of minutes, which I thought was very reasonable. A few students also said they would have liked to see labeled anatomy in the virtual reality environment. So I've already addressed that. I've used an engraving feature to label some of the larger organs in the demonstration today. Now, I had my own hypothesis of when either platform might be the most useful to their studies, but actually their opinions were really different. So this suggests it could be applicable to multi-level learning opportunities, and I really look forward to the opinions of our senior educators. So I think we really met my goal for this educational tool being fair. It's flexible. We can demonstrate very specific anatomy and pathology, different classes, specific research. It's accessible. It's cost effective, and you can access it from anywhere on a laptop. It's interactive. The VR environment is immersive, and multiple people can work on the same project and interact with the model at the same time. And it is relevant. I cannot say this strongly enough. Medical imaging increasingly supports multidisciplinary workflows. It is used in the diagnosis, the treatment, and the monitoring of many different pathologies. And so there is potential for so many different anatomical and pathological structures to be built and used as learning resources. Not only that, but it's digital. It is so well placed to integrate with new technology because it already exists in that digital environment. Now, in terms of taking this project in future directions, there are so many, and it was hard to narrow it down. But firstly, I would really like to make the case for developing in-house software, creating interactive digital resources that can be customized for particular classes, specific pathology, rare disease research, not just for students, but extending those resources to the community, individuals, clinicians, junior doctors, radiographers, moving from X-ray into CT, and especially to support those understandings of rare variants and pathology. I would also like to recommend that more students learn how to segment CT and MRI medical imaging volumetric data sets. Not only because it is applicable if they're interested in surgical planning, 3D printing, developing prosthetics, rare disease research, but because personally, for me, it has been an incredible learning opportunity, and I have really consolidated my understanding of anatomy through building these models. And finally, we really look forward to progressing this project through my honours year, gathering more qualitative analysis, getting more feedback, optimising this tool, speaking with more medical students, senior educators, and of course, clinical staff. And before I finish, I would just like to acknowledge our wonderful sponsors, the Perth Radiological Clinic Foundation. Thank you for your generous donation to this research. It has fully supported this wonderful opportunity. I am delighted to present this project to you, and I hope you are as excited about the research as I am. Thank you to the student participants and their valuable insight, my senior student advisors, the MRS staff for letting me crash their classes and steal their students, Jared and the Curtin IT team, my supervisors, Zhonghua, Mauro Vaccarezza, Ash Doshi, and the staff from the Curtin HIVE. I have learned so much, and the previous staff and students who have helped me develop the skills to make this project possible. And all of you, and online, thank you. And I would like to invite you to try out my demonstration today, and I particularly welcome those of you who have never tried virtual reality before. Thank you.